Here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So are you seeing an increase in whooping cough?
Not really. I see adults. I don't see pediatric patients or the population. But the new thing is that we're recommending the vaccine for adults for whooping cough. That's something new as a result of this resurgence of the infection. As you know, grandparents are around a lot of the kids. The grandparents are unvaccinated, and so they can infect actually the kids. So it's important for both to be vaccinated, just like the flu and any other vaccine. We're trying to prevent spread and control the infection. You might still get the infection, but the severity is less, doesn't last as long. So it's also about controlling the spread as well.
Now, a lot of times people are vaccinated when they're babies, but how long do they need to be vaccinated again? At what time length?
Yeah, as the segment mentioned, sometimes the immune system wanes and they need a booster. I think there is a program of immunizations that every infant and young kid gets. It's kind of on a routine. The pediatricians know about it. The moms know about it. Then I think at about 12, 15, they kind of get another booster, and then maybe 20 years old, etc. And then they just kind of fall through the floor. Nothing happens until the age of 60, 65. So you have to get it periodically. And certainly if you feel like you have the whooping cough, get to your doctor and get treated for the infection.
A lot of people right now are coughing. Is it allergies, or do we need to be concerned maybe it's whooping cough?
Yeah, it could be. We have to hear that characteristic whooping sound before we even think about that. But some of the antibiotics that we use are the treatment for whooping cough, so maybe we may be treating it but not knowing it. But we have to hear that characteristic sound before we even really think about it.
Okay, on to some of our viewers' medical questions. This person wants to know, help them understand gluten intolerance.
Yeah, this is a issue that a lot of the people have out there, a concern, I should say, about that. It normally causes GI upset, abdominal pain, diarrhea, sometimes weight loss. But certainly it's an ingredient. A lot of the starches that we eat, some people just have kind of like an allergy to this ingredient. You have to change your whole diet. The diagnosis normally involves some blood tests and maybe endoscopic evaluation with a biopsy. But it is popular. I would just say be sure and get a proper diagnosis before you label yourself as having this disease, because I see a lot of patients saying I have a gluten sensitivity or a gluten intolerance, but really haven't had the proper workup.
Okay. This person says, I have bad heads every day. What kind of doctor should I visit?
I'm assuming they may be talking about headaches, and certainly you can start off with your primary care physician. Certainly some blood tests, x-rays can be done. Some medications good on the market for headaches, which normally involve migraine or stress headaches.
Okay. My daughter was diagnosed with bronchitis. She's coughing really bad. We're doing breathing treatments. She was given Brom-fed DM syrup. What else can I do for her cough? She's coughing so bad that she sometimes gets choked up.
Yeah, a lot of times an adjustment of the breathing treatments, sometimes steroids, although like I said, I do a lot of adults. Some people are a little squeamish about using steroids in young kids. It may be the wrong diagnosis, so obviously get back with your primary care physician or the treating physician. May need a chest x-ray, but a lot of times just adjustment of the medications can help.
Okay, this person had a hysterectomy 3 weeks ago. She's been having crying bouts where she can't stop. She's on hormone replacement. Should she contact her doctor to see if something different should be done, or is this normal?
It can be normal after hysterectomy, very emotional situation. A lot of times if patients are coping, nothing necessary, but if they're having maladaptive behavior, can't go to work, etc., I think medicine's necessary.
All right, Dr. Levine, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. A 67-year-old woman has never had chicken pox as a child. Should she get a shingles vaccine?
Absolutely. A lot of times you don't have to have the actual infection when you're young to have a latent viral infection. So yes, we do recommend that because actually as you get older, we tend to become infected with that particular virus. So you don't have to have the rash as a young person in order to qualify to get that vaccine as you get older.
And once you get the shingles, can you have it again?
You can have shingles again, and we certainly still recommend the shingles vaccine for patients who've had shingles. It still helps reduce another flare. You may have to wait maybe a year before you need to get the shingles vaccine if you've never had it, but certainly it still helps, absolutely.
And so right now we're seeing a lot of commercials for open enrollment as far as different insurance companies, HMOs. As far as Medicare, should people stay on Medicare or should they get off of Medicare and get on an HMO?
I think for what I know, they can stay on Medicare. They don't have to get another insurance. The insurance exchanges, state exchanges, is for people who don't have any insurance. So that's primarily what that's for. If you have Medicare or you're happy with your current insurance, you don't have to do anything. You just keep your current insurance.
Just keep on keeping on.
Keep on trucking.
All right. What is HPV?
Human papillomavirus becomes popular when we talk about cervical cancer screening and pap smears. Also, a problem with head and neck cancer that's becoming an issue recently. So get those vaccines for young women, and certainly if you feel like you have, a mass in your neck or your throat, certainly get that checked out.
Okay, a 77-year-old woman had a hysterectomy. Should she still get those annual pap smears?
I'm of the thinking no, unless the hysterectomy was for cervical cancer. You might need some continued screening pap smears, but if it was for something other than cancer, I say no. Certainly if you have any discharge that's abnormal, bleeding that's abnormal, certainly get another evaluation.
Okay, a woman has renal carcinoma. Everything from the knee down is always freezing, while everything else is hot. Why is that?
I don't know if that has anything to do with that. That's kidney cancer, by the way. Cancers can do a lot of funny things to the body temperature. We don't really have a therapy or treatment for that. Dress warmer, dress cooler, that sort of thing.
Okay. This person gets headaches a lot when she was 9. Now, is there anything that she should be concerned about?
I think anytime you have head pain and you don't know what's causing it, certainly be concerned about it. It could be the sign of something very serious. The more signs you have or the longer it lasts, and the more concerned you should be. So certainly get it checked out, x-ray of the brain, maybe some medication, and some blood work to see what's going on.
This person has a stuffy nose and a cough, and a 3-year-old who's just finished antibiotics, and they are on Zyrtec daily. Anything else that needs to be done, or is this simply allergies?
Not necessarily. It doesn't always go away automatically. It may last for a week or so, as long as there's no red flags, continued fever, a lot of drainage. It should be okay. Certainly check with your pediatrician. Might need adjustments for medication or another round of antibiotics.
Okay. I've had diarrhea going on 7 weeks straight. I started after I ate sushi. Then I started Lomotil, and I've been on Imodium and no improvement. Any ideas what it may be?
Yeah, once it goes beyond 4 weeks, that's considered a chronic diarrhea. Normally you have to do a endoscopic evaluation to look inside the colon and see what's happening. They might have a gluten sensitivity issue. So blood work, colonoscopy, certainly don't let that go. Might even be an infection. That's way too long to have diarrhea.
Yeah, and they've even lost 9 pounds in the last 3 weeks.
That's a red flag, by the way.
All right, Dr. Levine, thank you. And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.